Hi, thanks for joining us for a Bridge Integrative Medicine webinar. Today's topic is on chiropractic care. My name is Jeremiah. I'm going to be your host, and Dr. Jim Wyllie is going to be our special guest today.
Now, Dr. Wyllie, I know you've been a chiropractor for, seems like forever, 30-some years. You've taught at UMKC Med School on chiropractic care. We get a lot of people that ask, though, what is chiropractic care? Can you kind of go through that with me?
Well, sure. Yeah, chiropractic care is essentially the emphasis of chiropractic is on the spine, and it's the restoration of the function of the spine so that the body can work appropriately as it's designed. And the influence of the chiropractic adjustment is local, but it's also very global in its effect on how people respond to care. So, and that's because the spine itself is so encompassing of so many different systems.
Yeah.
In fact, I have a spine here. Let me just kind of show you what.
Yeah, hopefully not a real spine.
Yeah, right. Yeah, there you go. So this is spine, the pelvis, the lower lumbar spine. This is called the thoracic spine, the cervical spine, and this represents the top of the base of the skull. So when I first started in learning about the spine, it was a very important part of my life in time, because I had also actually begun to understand a little bit more about who God was during that time of my life. And so as I looked at the spine, I was amazed at its structure. And so I just kind of want us all just to marvel a little bit at what this really is. But if you think about the body in the way that it is designed, when God designed man, he had to make it so that he could stand upright. And so the structure of the spine, the weight of the pelvis, the curves of the spine are all designed to hold an upright structure. Pretty amazing when we think about that, but that's absolutely what it is. It's this upright spine and good, proper and posture that goes along with that. But along with that, there's a part of the brain called the spinal cord that had to run inside of that, because he needed to protect that part of the nervous system. That nervous system then goes and controls and regulates all the functions of the body. And so he had to put that in a something that had a hollow tube in it, and then allowed exit points for those nerves to branch out and go to all the different organs and tissues of the body. So made this hollow tube called the spinal column, which the spinal cord runs down inside of, just simply an extension of the brain. Pretty amazing, right? Yeah. And then while it's holding posture and is protecting that spinal cord and the nerves that exit through little openings in the sides, it also had to move, right? It had to be able to function and bend and allow the body to bend in all sorts of different positions. And so each one of these then represents not just a conduit, but actually movable segments with 6 joints at each level, so that it could accommodate rotations and side bends and flexion and extension. And so we end up now with a spine that contributes to posture, also to protection of the nervous system, and then movement of the body. Well, I think the spine is one of the most forgotten organ systems of the body, honestly, because it represents a system that affects every other system, and chiropractic saw this as the centerpiece of what it did as a science and as an art. Yep. And so chiropractic really works to help the body maintain good posture. We really emphasize here at Bridge Integrative Medicine posture and how important that is for the structure of the spine. Poor posture starts to create breakdown in the spine itself and its ability to hold our bodies upright, and we end up with all sorts of odd postural changes like scoliosis and kyphosis and forward head postures and all sorts of things that really create issues for us. Yeah. But beyond that, it also works to make sure that the spinal column is not impinging or irritating nerves in any way, creating a signal that the brain interprets as pain if it's bad enough. And so the nervous system is affected by all of this. And so we want to make sure that those nerves are well protected by a wholly functioning spine. And what we emphasize is the restoration of motion of the joint. So through postural stresses, maybe with things that we do every day, typing, or maybe we lift something wrong and heavy and we shift something. Anyway, things lock up and stop working like they're supposed to. Well, if a part of your spine does not work like it should, it doesn't do as good a job of protection of that nervous system in that time, and it also can start to influence the posture. So what we do in chiropractic is we call it vitamin M. It's an injection of motion into the spine, but the way we do that is mechanically through an adjustment, restore movement where movement is lost. So one of the jobs of the chiropractor is to check the spine thoroughly to make sure it moves in all the aspects, in all the different directions that it's supposed to. Right. And when we find problems there, begin to restore movement at that segment that's having a problem. So exercise moves your whole body, but if you're just exercising and you have an area of your spine that does not work like it should, then exercise is going to overwork one area and not work another. Right. And so what we do in chiropractic is make sure that we restore the movement in the joints that aren't working well, and then exercise has its best influence on the body. We can start to work on all sorts of global exercises that then strengthen that. But if that area isn't working, it's much like if it's in a cast. Yeah. If you've ever been in a cast?
I have never been in a cast. No.
Oh, wow, that's
never
amazing.
Never broken a bone.
Yeah. So actually me either, but I sure have seen a lot of patients that have had casts or splints or braces, and the muscles atrophy very quickly. Yeah. Well, that's exactly what happens in the spine. Through old injuries and traumas, those muscles around those areas, if it stays locked up, much like a cast, stays locked up for a while, those muscles around it atrophy and weaken. And so the only way to change that is to get motion back and then start re-engaging, exercising in that area very specifically.
So when we go through an adjustment then, and you have someone who sits down in front of you and you're adjusting their spine and their neck and everything, when you hear that popping sound, that's actually one of those 6 joints that's on each of those spinal pieces that's actually going back into health, basically.
Yeah, kind of. Yeah, that's back to movement. I would say that's right. So that sound, the pop, is what we call cavitation. Right. And cavitation is simply a gas that escapes from the fluids that bathe the joint and actually cavitate or make a little gas sound. It's much like if you cracked your knuckles. Right. It would be that. You're not really. It's not necessarily that you're putting something back in place, but you are just increasing the range of motion of that joint to the point that the liquid cavitates or the gas cavitates, nitrogenous gas cavitates in the joint. And you can't, that's why you can't, if you cracked your knuckle, you couldn't crack your knuckle right away again. It takes a while for that to reabsorb back into the fluids of the joint. So the sound to us is just a sign that we were able to get that joint moving a significant amount, still well within its parameters of motion, normal parameters of motion, but enough to get that joint functioning again. It's a very good thing. Now, sometimes people are so stiff that you don't hear any of those cavitations, but we can still increase the motion even without making the noise and restore some motion. Hopefully, as they go through our rehab program, muscles start to relax a little bit more, and we can get in where we can cavitate the joint better, and always that results in good for the patient. Okay.
Thanks for joining us today. If you want to make an appointment for a chiropractic adjustment, you can call our office at 816-454-5433.